Hi, my name is Gabby, and this is Ethan and Lindsay. Our project is What Does Being an Adult Gero Acute Care Nurse Practitioner Mean to Me? And the purpose of this video is to promote our profession with the general public, explain the qualifications and roles of an adult gero acute care nurse practitioner, as well as share a personal story about why we chose this profession. We hope you enjoy it.
Ethan and Gabby, thank you for sitting down with me to talk about what an adult acute care nurse practitioner does. So I am currently an RN and I am looking at furthering my education. So can you tell me a little bit about what y'all do in your daily role?
Sure. So as an adult gero acute care nurse practitioner, we see adult patients with acute and complex diagnoses across various settings. Essentially, we are healthcare providers, and we're specially trained to educate, diagnose, prescribe medications, order and interpret diagnostic tests, and to generally manage and develop the plans of care for our patients. In addition, the role of the acute care nurse practitioner is very procedural, and this can be anything from simple joint injections or aspirations to more invasive procedures such as intubation and inserting central lines.
Okay. Great. And then what type of settings do you typically work in?
So we like to say that if it's within 4 walls of a hospital, we can work there. So you'll find adult gero acute care nurse practitioners in particular working in ICUs, step-down units, in the emergency department or on a trauma service. It can also work in specialty clinics and just the floors of oncology, orthopedics, derm, palliative care. There are really a lot of potential settings for us to work in. There are also a lot of less traditional settings. We can work in the military. There's also flight nursing, which a lot of people think is really cool.
Oh yeah, that's awesome. A lot of options. And then right now, as a registered nurse, what do I need to do to become an APRN and move into that role and be credentialed?
Right, so all of us are prepared at least at a master's degree level or higher. There is a push to make it a terminal degree, so you have to have a DNP, a doctor in nursing practice, but right now you can graduate from an accredited master's program and be eligible to sit for the boards. For our specialty in particular, there are 2 boards that you can take. You can choose which one is right for you, but if you pass that successfully, you will be certified on the national level, and then all you have to do is register with the state as well.
Okay, excellent. And then on a personal note, why did you decide to become an adult gero acute care nurse practitioner?
I can take that question. So when I was in college, it's been several years ago now, my grandfather actually got really sick and was in and out of several hospitals. And it was at that time that I really was able to see the role of nurse practitioners in the acute care and inpatient setting. Before then, I guess I hadn't really realized that they have such a large role in these critical care environments. I had kind of felt nurse practitioners were primarily in outpatient settings or primary care. And while he was sick, my grandfather received some of the most compassionate and patient-centered care from these nurse practitioners. And I really kind of said, that's something that I would want to do. And I made it happen. And that's really what kind of drove my career choice.
Okay, that's excellent. Thank you so much for this information. Y'all have been great help. And thank you again.
Yeah, best of luck to you.
Yeah, you're welcome. Good luck with everything.
Thanks.